Today, to address the topic that we chose for the session today, we have a panel of distinguished speakers. We have Ozge Karadag. She's a professor of public health at the School of Medicine of BAU in the University of Istanbul. We have Selma Karabey. She's a professor of public health at Istanbul University Medical Faculty. Nuhad Yazbik Dumit, she's a professor of nursing at the Hariri School of Nursing at the American University of Beirut. Rabin Pasha is the founder and CEO of Social Development Horizons in the US. We have Paul Spiegel, is the director of the Center for Humanitarian Health at Johns Hopkins University. Paul is online. Thank you very much, Paul, for being with us very early for him in the US at the moment. We have Ivory Horn. She's the director of the Health Equity Office of Google. We have Professor Stephen Matlin. He's a visiting professor at the Institute of Global Health Innovation at the Imperial College London. And Santino Severoni is the director of the Health and Migration Program of WHO. So without further ado, I would like to leave the floor to the first panelist. I ask all the panelists to try to be very brief because, as you can see, we have a very large panel of 8 speakers. And we would like also to leave the floor at the end to all of you for questions and comments. So please start to reflect on possible questions because at the end, we will open the floor to give the opportunity to some of you to intervene. So now it's a pleasure to leave the floor to the first speaker, Ozge Karadag.
Thank you so much, Professor Sasso. So I'm not sure, so this is working, I think. Okay, so thank you so much. I actually want to start with a brief introduction of why we wanted to focus on this topic. Because as you know, we all have some kind of barrier in accessing health information or services, including social determinants of health, language, our legal status, and other factors. But we all know that these factors are more prominent, or these barriers are higher for forcibly displaced populations. We wanted to focus on young people because we know that young people, especially young girls, stigmatized, marginalized youth groups, are among the most vulnerable when thinking about, again, forcibly displaced populations. And we know that in most of the forced migrants and forcibly displaced populations, the proportion of children and young people is usually higher than general populations. And we also know that innovative technologies offer great potential for improving health literacy and improving access to health care. But of course, we also need to consider digital divide, and we also need to consider barriers in accessing digital technologies, internet, which may not be accessible for all, especially in terms of gender. Today, in my talk, I briefly would like to talk about the importance of community participation and youth participation when we plan, implement, or evaluate digital health interventions. And as we know, community participation in health means that we involve individuals, communities in planning, implementation, or evaluation of health policies, practices, and research. And it's very critical to include disadvantaged populations in our work because they can identify problems and solutions better, and they can tailor responses to the needs of diverse populations. And why we should involve young people in our research or digital health interventions, because we obviously want our research or health intervention to be culturally sensitive, youth-friendly, and to be based on the real needs of young people. And if we involve them to our work, and if they are actively engaged, then it also helps to raise awareness among young people about their own health problems and needs. It also increases acceptability of the research or intervention. It increases trust to the researchers or the project team. And it also helps with increasing the level of participation of young people in our health interventions. We better identify their motivations and barriers, especially if we want to change a health behavior or if we want young people to utilize some kind of a service or digital tool. And I believe participation and involvement of young people also helps with increased control of young people over their own lives and health. And it empowers young people. They have better problem-solving skills. They have increased self-esteem, and they feel being valued when adults work with young people. And lastly, I think it also helps with improvement of social bonds and social resilience among young people. When we think about digital technologies, we can involve young people in our research, digital health research, by using, for instance, community participatory research approaches. We can include them in our advocacy efforts to inform future health policy making. We can involve them in co-design of digital health interventions. We can involve them in implementation of these interventions and also evaluation phases. And lastly, I would like to say that field experience of many research groups and scientific evidence from around the world show that youth participatory and co-design approaches increase the success rate of digital health interventions in multiple ways. Youth participation is even more effective if we also use peer-to-peer, like youth-to-youth approaches. For instance, training young people to act as digital health mediators or digital peer educators in reaching out to other young people or referring them to available health services. In summary, active engagement of young people ensures that we create tools that are youth-friendly and more sustainable in the long term. Thank you.
Thank you very much, Ozge.